Rural hospitals across the state are having to make tough decisions, and they could have an impact on future generations. Thank you for joining us tonight at 6. I'm Faith Woodard. We've been following the issues rural hospitals have been facing for years, but after news of another hospital stopping its maternity services, mothers in those areas are now wondering what's next. THV 11's Maya Ellison explains why these closures are happening and what mothers can do if they're without resources.
So every time a unit closes, that means that the moms who had been driving to that facility, that was their nearest facility, now have to go even farther at one of the most vulnerable times in their lives.
This is the reality many mothers are facing in rural communities, as more and more hospitals across the state announce the closure of their maternity wards. In August, Unity Health Newport Hospital announced the discontinuation of its labor and delivery units, leaving the state with only 34 hospitals that provide those services.
So labor and delivery is an expensive service to run, especially for hospitals that do a relatively low number of births every year.
In addition to costs, rural hospitals experience a lack of staff and workforce shortages, causing mothers to seek services in more centralized locations that might be out of reach. Heartland Forward Health and Wellness Senior Fellow Kara Osborne said that makes it even more challenging for mothers who might be close or even going into labor.
You have to find childcare for your other kids. You have to have access to a car. You have to have gas for that car. It's more than just the labor itself.
So where can mothers find resources if they're out of reach?
Doulas are the resource.
In Arkansas, organizations like the Doula Alliance have come together to combat the lack of labor and delivery resources in rural communities. Nicole Fletcher is the co-founder of Ujima Maternity Network. Through her work, she looks for ways to emotionally and physically support mothers who might face additional challenges.
Let's grab some CHWs and let's do some transportation that are in this area. So it's just kind of looking at what's in this community, what resources are available.
While these issues might be taxing for mothers in rural hospitals, Fletcher says the road to improvement isn't far out of reach.
We're not going to improve unless we collaborate.
In Conway, Maya Ellison, THV 11 News.
Thank you, Maya. Fletcher says in spite of these limitations rural hospitals face, it comes down to communicating and making mothers aware of resources such as doulas and midwives.